So when patients come in for an acupuncture treatment, they never know what to expect. Acupuncture can be quite foreign to folks in our country, but fortunately it's gaining a lot of popularity because it's such an effective treatment. When you come into an acupuncture treatment, the acupuncturist will more than likely ask you about more than what you came in for. So for example, in the case of tennis elbow, I'm certainly going to treat the tennis elbow, but I'm also going to ask lots of questions about your sleep. I'm going to ask you about your bowel function, about digestion, a whole range of things so I can create this holistic picture of how you're doing and some of the things that might be contributing factors to the main reason why you came in.
Yes.
Yeah. Okay. Any nausea or vomiting?
No.
Okay. That's cool. How's the asthma been? Using the inhaler still? Okay, so I'm going to still do some of the local needling as we've been doing before, but then I'm going to also use some distal points and do some things for the asthma as well. So you're dressed perfectly, thank you. But I also like you to roll your pant leg up just above your. So after this short interview, I'll do a pulse and a tongue diagnosis. A pulse diagnosis involves me taking your pulse on both of your wrists. So it's the radial pulse, the pulse that is from the thumb side of your wrist. So I'll be placing my hands in 3 different positions on both arms. Each of those 3 positions on both arms tells me a little bit about the organ function. So like on this left side, you know, this pulse corresponds to your heart. It tells me a little bit about your sleep. It's a little empty, meaning that when I touch it, it kind of runs away from me. So it lets me know that there's a little bit of weakness here. So when I say your heart pulse, I'm not necessarily talking about the organ itself, but energetically what it represents. So the heart, for example, dominates our sleep. So it tells me that you are waking up at night. It's not significantly strange, but you know, it just kind of points me into an area. So the right side of your pulse will tell me about the function of your lung, the spleen and stomach, and on the right side will be kidney yang or kidney yang as we say in this country. On the left side, those pulses tell me more about the condition of the heart. It tells me about the liver, and on the left side it also tells me about kidney yang. So after I do that, then I'll take a look at your tongue. The tongue is what we call a microsystem of the body. Looking at the tongue tells me lots about how those organs are functioning. It tells me about the fluid levels in your body. It tells me about your metabolism. I'm looking at the size of the tongue. I'm looking at the shape of the tongue. I'm looking at the coating of the tongue. And I'm looking for any unusual marks, any type of fissures or any type of cuts. Okay, let me take a look at your tongue. Tilt your head down just a little bit.
Down.
Yeah, that would be down. Oftentimes with people, for example, who have trouble sleeping, they may have a redness at the tip of the tongue. The tip of the tongue corresponds to the heart. The heart plays a very intimate role in creating restful sleep. So when I see some redness at the tip of the tongue, it tells me that that sleep can be disturbed. So I'm looking at that and trying to create this really nice picture to say, ah, this is it. This is what makes this person unique. And this is what makes this particular treatment program that I'm going to put together for my patient unique to that particular patient. Once I take the pulse and tongue diagnosis and after the brief interview, that's when I create a treatment plan. I decide what set of points I'm going to use. It can be as many points as from 5 to maybe 12. It really depends. Sometimes it could be just a single point. It really depends on the particular condition. After I make those point selection, I go ahead and I swab the areas with alcohol where I'm going to insert the needles. Then I insert the needles one by one. I ask the patient to just kind of focus in on their breath, not necessarily deep breathing, but just conscious breathing in and out through the nose. Once that has been established, then I go ahead and insert the needles. Upon needle insertion, there's a little tiny prick most times, and after a few moments, that sensation should go away. Once that sensation goes away, we're all good, and then I go ahead and insert most of the needles. I once had a client, she had come in for the very first time to my office that never had acupuncture before. She's laying on the table, and I'm putting the needles in, and she says, she's sitting there, and she says, okay, let me know when you're gonna put the needles in. I'm like, oh no, they're already in, they're there. So everyone tends to respond a little bit different to the needles. Some feel the needles right away, and that'll be like a little small prick. And some other people don't feel it hardly at all. The sensation overall, however, should be quite subtle. The needles in acupuncture are quite different than the needles that you use in conventional Western medicine. In acupuncture, we use what's called filiform needles, and they're solid, pre-sterilized stainless steel needles. In Western conventional medicine, the needles that are used are a little bit longer and they're not solid. They're hypodermic needles. So they have a little hollow in the center of the needle, and that's used for either injecting medicine or injecting fluids, or for withdrawing fluid or drawing blood. We don't use those needles at all. In fact, the needles that we use in acupuncture are so tiny and fine that you can fit, say, 30 acupuncture needles within the shaft of a Western conventional medicine's hypodermic needle. So they're two totally different needles. So I kind of like to let people know that, because oftentimes in this country, in the United States, our experience with needles is not often a friendly one. So it's quite distinct. Those small needles that we use in acupuncture can be as fine as a hair. They're super fine, they're super small, and the insertion depth is very minimal. It could be from 1/8 of an inch to maybe about an inch. Typically, I insert a needle about 1/4 of an inch to 1/2 an inch. There's cases where I insert at a more shallow depth, and there's also cases where I insert a little bit more deeply. It really depends on the patient, and then also depends on the place where I'm inserting the needle.